About 5 or 6 years ago, I first learned about adverse childhood experiences and how we could become trauma-informed aware in the practice. And as part of that, I met with Gareth Nixon and we started the journey to try to make West Gorton a trauma-informed practice for all of our team, and also to look at how we could bring that work forward to try to improve the care and health and well-being of our patient population. We formulated a training afternoon for the whole team here at West Gorton so that we could train the whole team on what ACEs were, adverse childhood experiences were, how common they are, and how we could become a trauma-informed team.
When I got off the radar.
So what we wanted to do then was to look at our patient population and see what impact we thought adverse childhood experiences and trauma were having on our patient population, and really look at how we could improve the care that we're giving to the people of West Gorton. And then so it's really important that we let you know what kind of support we have available. We know there's patients who've suffered from lots of trauma, whether that be in a childhood or through their adult life. And there's long waits for psychological therapy and things across the city, actually. So we looked at how we could maybe get some further psychological support for our patients in-house. So we found Sam, who is our trauma-informed yoga therapist. We now refer patients to Sam and have her working with us 3 days a week. Having the trauma-informed yoga therapy at West Gorton has been the major thing that has helped us have somewhere to direct these patients to who are suffering with the impacts of their previous trauma. And the fact that we can refer children to her, anyone from 5+, means that we can try to reduce the impact of any toxic stress on our current children as well.
Patients find many benefits from the yoga sessions. They gain their own toolkit, basically, for managing emotions, overwhelming emotions, managing difficult feelings. It can help to keep blood pressure at optimum levels. Obviously improves breathing ability, so people with lung difficulties, COPD, find benefits like that. Relaxation so that they can sleep better. And putting things into perspective, that not everything is a here and now danger.
Okay, it was a little bit strange, and you've not done this before.
I think the main thing in primary care is, first of all, for the team to ensure that everybody is trained in being trauma-informed. The patient journey starts from when they pick up the phone to that patient, or from when they turn up at reception. So it's not okay for just one GP or for just the GPs to be trained. So I think it has to be across the primary care team. And it's just so important that everybody is aware to look behind why somebody might be seeming distressed or maybe seeming getting cross, and try to see how we can help them there and then. And then I think if you have it as a team-wide approach, and then in the GP consultation, the nurse consultations, they can go into a little bit more detail to start asking those questions of our patients. Because until you ask the questions, I don't think you barely scratch the surface as to what people may have lived through. And I think that it's imperative that GPs move forward with this work, train their teams, use this in their consultations, and have a look at what small changes they could put in place in their practice to really try to help support their populations.